This video is a part of a series designed to educate people about mental health. This is not intended as medical advice, but rather as an introduction. If you have any questions about this or other conditions, you should speak to your pharmacist, physician, or another healthcare provider.
What is anxiety? Anxiety is defined as a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. This is a normal reaction that people experience. It is common to feel this way before an exam, job interview, important discussion, or other potentially stressful events. When things get more severe than this, there may be a diagnosis of an anxiety disorder when the symptoms experienced cause significant distress and stop someone from doing day-to-day things. This is referred to as functional impairment. People living with anxiety disorder may find it difficult to function in areas of life such as social interactions, family relationships, work, or school. Often, different anxiety disorders occur together or with other conditions such as depression or substance abuse. Anxiety disorders aren't just black or white. There are 7 main anxiety disorders. These include social anxiety disorder, post-traumatic stress disorder, panic disorder with or without agoraphobia, obsessive compulsive disorder, specific phobias, generalized anxiety disorder, and separation anxiety in children and youth. How common are anxiety disorders? Anxiety disorders affect approximately 12% of all Canadians, making them the most common of all mental illnesses. In general hospitals, hospitalization rates for anxiety disorders are twice as high among women as men. The highest rates of hospitalization for anxiety disorders are among those aged 65 years or older. What are the symptoms of anxiety? Each of the anxiety disorders has a specific set of criteria for diagnosis. Behavioral avoidance, excessive worry, and physiological signs of anxiety are some of the most common symptoms of an anxiety disorder. Together, these interfere with the quality and function of daily living. For example, for individuals who live with social anxiety disorder, exposure to social situations almost invariably provokes an immediate anxiety response. Early recognition and appropriate management are imperative in order to enhance the quality of life of individuals living with anxiety disorders. Proper recognition and management also help to prevent common secondary disorders such as depression and abuse of drugs and alcohol. Medication is an important part of therapy. Here's a list of some of the medications that are commonly prescribed to treat anxiety disorders and that you may see. A recent review of anxiety disorders suggests that effective treatments include drug therapy with antidepressants or anti-anxiety drugs, and cognitive behavioral therapy, which helps people turn their anxious thoughts into more rational and less anxiety-producing ideas. Support groups for individuals and families can also help develop the tools for minimizing and coping with the symptoms. Most people who have an anxiety disorder, or any mental health condition really, often feel like they are isolated and alone in dealing with it.
We're here to tell you that you are not. There are many support tools available online, and many community resources are also available. There are also several mental health management apps that can help you self-track for coping with mental illness. Check out the links provided for more information.
But what can my pharmacist do for me? Pharmacists are not usually considered as a support system for mental health needs, but we want to change that. We can provide a variety of information about your condition, medications, and managing it. A pharmacist is on the front lines of the healthcare system and can be your initial support system in dealing with your mental health condition. You can always speak to your Wholehealth pharmacist, or if you don't have one in your area, go to your local pharmacist.